diagnosis of simple febrile convulsion, mainly clinical generalized tonic-clonic seizures, symmetrical in both sides. No other neurological disorder, less than 15 minutes and maximum 1 per 24 hours. Typical age 6 1 to 5 year, non-specific diagnostic workup, focus on identifying cause of fever. History exam, urinalysis and room culture, CBC, CRP, electrolyte, cost imaging to locate source of infection, toxicology screening in case of suspected intoxication. Less than 15 minutes generalized, usually tonic-clonic, symmetrical max 1 seizure 24 hour, more commonly than complex diagnosis of complex febrile conversion. Simple febrile conversion or seizures associated with fever in young children, particularly between the age of 6 months and 5 years, without an underlying central nervous system infection or get electrolyte imbalance. The diagnosis is largely clinical based on characteristic, history, and presentation, and exclusion of more serious causes. Clinical criteria for simple febrile conversion age typically occur in children aged 6 months to 5 years. Fever seizure occur with a plus temperature over 38 degrees and not caused by intracranial infection or defined cause of seizures. Seizure characteristics, generalized seizure lasting less than 15 minutes occurs only once within 24-hour period. Neurological status, no evidence of pre-existing neurological disorder or developmental delay. Initial evaluation, detailed history, description of seizure including onset, duration, and specific features, consciousness and movement, timing and height of fever relating to those features, recent illness or symptoms suggesting infection, family history, a febrile seizure or epilepsy, physical examination, assessment or signs or meningitis or encephalitis, nystagmus or premental status. Search for source of infection, otitis media, upper respiratory infection, gastroenteritis, complete neurological examination after the child has recovered from the seizure diagnostic test. Lumbar puncture, consider if meningitis or encephalitis is suspected, especially in infants under 12 months, or if the child appears very low electrolyte and glucose to electrolyte imbalance or hypoglycemia. The clinical picture is atypical, and blood and urine cultures, if there is suspicion or overall serious bacterial infection, your imaging not routinely recommended for simple febrile seizures, but consider if there are focal neurological findings or a prolonged prosthetic state and differential diagnosis. Complex febrile seizure, longer duration over 15 minutes, focal features or smart procedure within 24-hour period. Sinus infections such as meningitis or encephalitis, where fever and seizures are accompanied by sign of meningeal irritation or rudimental status. Epilepsy, recurrent seizures without fever, and acute symptomatic seizures due to electrolyte imbalances, poisoning, or focus serious infections. Inserts on management considerations, simple febrile conversion are typically benign and self-limiting with an excellent prognosis. Education and research over parents about the nature of benign post-op simple febrile seizures are crucial. Antibiotic can be used for comfort and to control fever, but do not prevent febrile seizures. High points. Simple febrile conversion are diagnosed based on the clinical criteria, and extensive diagnostic testing is not usually necessary. Key aspects of diagnosis include confirming the presence of fever, ensuring the seizure was generalized and brief, and excluding more serious cause of seizures and fever. The management of simple febrile conversion focuses on identifying and treatment, treating the underlying cause of the fever and provide reassurance and education of caregiver. Okay, so let's sum up. Diagnosis of simple febrile conversion, mainly clinical, generalized tonic-clonic seizures, symmetric in both sides, no other neurological disorder less than 15 minutes, and maximum 1 per 24 hours. People aged 6 months to 5 years of specific diagnostic workup, focus on identifying cause for fever, physical exam, urinalysis, and room culture, CBC, CRP, electrolyte, blood glucose, imaging to locate source of infection, toxicology screening in case of suspected intoxication. Less than 15 minutes, generalized, usually tonic-clonic, symmetrical, max 1 seizure within 24 hours. More common than complex diagnosis of complex febrile conversions. Simple febrile conversions are seizures associated with fever in young children. Age, typically 6 months to 5 years. Fever, temperature over 38, intracranial infection, caused by intracranial convulsion and seizure characteristic generalized seizure lasting less than 15 minutes and occurs only once within 24-hour period. Neurological status no evidence of resisting neurological disorder. Initial evaluation, detailed history, seizure, onset, duration, and specific feature, timing, and hazel fever. Recent illness or symptoms suggesting infection, family history of febrile seizure or epilepsy, physical examination, assessment of sign or of meningitis or encephalitis, neck stiffness, or mental status, search for the source of infection, otitis media, respiratory infection, gastroenteritis, complete neurological examination, diagnostic testing, lumbar puncture, electrolyte, and glucose, blood, and urine culture, neuroimaging, and differential diagnosis, complex febrile seizure, longer duration over 15 minutes, forward feature, multiple seizure within 24-hour period, CNS infections such as meningitis, encephalitis, fever seizure, and epilepsy, symptomatic seizure management considerations, simple febrile conversion are typically benign and self-determining, and education and reassurance of periodic can be considered, and higher point simple febrile conversion are diagnosed based on clinical criteria, and extensive diagnostic testing is not usually necessary, and key aspect of diagnosis, including confirming the presence of fever, ensuring the seizure was generalized and brief, and excluding more serious causes of seizure and fever. The management of simple febrile conversion focuses on identifying and treating the underlying cause of the fever and providing reassurance and education to caregiver.